Welcome back to another episode of Unmask the Title. Today, we're going to talk about dental and medical advices. Since we're dentists and working in the medical field, I think it's my duty to talk about oral hygiene and educate people on how to do proper oral hygiene. So let's divide oral hygiene instruction into three different sectors.
Okay.
First one is proper brushing. Okay? I think a lot of people misunderstand brushing and they try to use their power to brush, thinking that powerful brushing will clean their teeth. On top of that, they use either medium or hard brushes, hard bristles. Okay? This is very aggressive to the teeth and to the structure of the teeth. Medium to high hard
to
brushes scratches the enamel of the teeth, which is the first layer or the protective layer of the teeth. So what we usually advise is to change it to soft brushes. Soft brushes or soft bristles are very gentle to the structure of the teeth, so they don't scratch them, and you end up with sensitivity later on. There's another question where they say, okay, but I use soft brushes and I don't feel that I'm cleaning well. Well, this is the second sector that I will talk about, which is adding water flosser to the to your routine oral hygiene. Okay, it's very important to floss, but I think it's time consuming to use the normal traditional floss. And I don't think a lot of people are doing flossing regularly or daily. So using water flosser is something very important, and it's very easy to use if the patient or the normal people knows how to use it properly. Water flosser is a very simple device, like a bottle. You fill it out with water. You can add a little bit of mouthwash to give more freshness to the mouth. And then it comes with different tips. Try to use the thinnest tip and put it between your teeth. And then try to close your lips on the tip of the water flosser. Why? So that water does not splash on your face and on the bathroom or so on.
And we'll have
Okay.
a nice shower.
Yeah. So this is how to use the water flosser. So if you add water flosser to the soft brush, I think with that you complete the circle of proper oral hygiene, and you protect your teeth from getting scratches or damaging the enamel of the teeth. Now, the last thing I want to talk about is the mouthwash. Mouthwash is very essential to your teeth and to your gum. It changes the pH of the mouth, and then it makes it less susceptible to cavities or caries, and it also protects and heals your inflamed gums. Okay? Now, what's the disadvantages of mouthwash? Mouthwash usually comes with colors, right? So those colors, especially the mouthwashes that has chlorhexidine, it changes the color of the teeth. So from white to yellow, if used frequently. So I usually advise my patient to take it 3 times per week, so that you don't stop it, the mouthwash, and at the same time you don't do it every day, because doing it every day will discolor your teeth, and on top of that it increases the calculus formation, which is increasing the stimulation of plaque and calculus on the teeth. And so instead of cleaning your teeth every 6 months, you'll have to clean your teeth every 3 to 4 months. And that's not really advisable. So use it 3 times a week per week is something really good. And try to avoid chlorhexidine mouthwashes, and also try to use alcohol-free mouthwashes, because alcohol increases the dryness of the teeth. Okay? That's basically it. That's everything I wanted to say in regards to oral hygiene. Most important thing is to switch to soft brush, please. Medium and hard brushes are a lie.
Yeah, to be honest, this is something we have discussed a lot, because I used to use medium bristles.
Okay.
And he was like, he gave me such a hard time about it. He's like, how could you be doing this to yourself?
And
You're
you're
a
a
dentist
dentist,
and
yeah.
you're using medium. And I was like, you know how everyone says, I feel like with the soft toothbrush, I'm not cleaning my teeth properly.
But the
This
point
is what I said, because my patient comes to me and said, okay, I tried using soft brushes, but I don't think I'm cleaning well.
Yeah, it was all about the technique.
Yeah.
technique and like the frequency is very important.
Yeah.
Or I think oral hygiene is something that you need to invest in. So I think even forget about manual toothbrush, go for electric toothbrush, where okay, it's the more expensive ones are hovering around 600 to 900 dirhams, but this is something that you're gonna keep literally for many years. All you're gonna have to do is change a battery and change the tip once the bristles are like falling apart.
But I also want to add something. Not every electric brush is good.
Exactly. So I was gonna mention the ones that are on the high end, which is like 600 to 900 dirhams, are the ones that are controlling the pressure,
Exactly.
making sure that you're not putting extra pressure on the teeth. It regulates that. The ones that are like 100 to 200 dirhams, don't get those. You might as well just stick to the manual toothbrush.
Yeah.
I think electric toothbrush is now the more superior way to go. And I think, like she said,
especially for people who feel like, a soft, normal manual toothbrush doesn't clean well enough for them, switch to electronic. But one thing that I think a lot of people don't understand is that the point of you having an electric toothbrush is for you not to move it. They get electric and then they use it as a manual. Yeah. No, okay, now you're going back to using as if you're using a hard bristle manual toothbrush. Like for me, obviously I have personally switched to soft and extra soft. But I saw it mostly in my mom and even his mom. Like I have worked on their teeth and I noticed that they had such like, it was the typical linear lines on their enamel. The abrasion marks on their enamel. And you had gingival recession all along. Like,
Which leads to permanent sensitivity.
And if you keep going at it, khalas, once your enamel is gone, there's nothing that's going to bring the enamel back. So now you have to move on to doing, I don't know, composite, veneer, crown, whatever the situation might be. So just switch to soft.
Plus bone resorption. If it affects the gingiva.
It can lead eventually like down the line to bone. But I have to admit something.
Tell me.
I think you already know this considering you have looked at my teeth. I don't floss. I have to admit this. And that's why I really want to get water floss personally. Because I just hate the whole like wrap the floss and go between the dental space.
I can just go to the back.
Wallah, it's really hard to go for the posterior
especially
teeth.
that, which I understand. This is what I said. It's time consuming. And the fact that you brush your teeth just before you go to sleep, that means while you're brushing, you're already sleepy, right? So you're not going to spend a lot of time flossing your teeth.
I do occasionally floss. But I just don't do it as regularly. Technically, you're supposed to floss every time you brush.
Exactly.
Which I don't.
So if you use water flosser, it won't take a lot of time. And at the same time, it actually cleans like much more effectively than the normal floss.
Yeah.
Because it's basically a water and pressure. So it cleans much more.
And I feel like, correct me if I'm wrong, you know more about this, but I feel like it's also less damaging to the gingiva.
Of course.
Because with the normal floss, you can easily, you know, hurt yourself.
You cut the gum, and it leads to bleeding.
Which is why everyone stops it, because they see the blood.
Yeah. With water flosser, no. You have two or three settings, either medium or low or high, medium, low. So you always go for the low, and then you try not to touch the gum with it. You just floss between the teeth, and that's it. You'll have, and additionally, you add a little bit of mouthwash to that. If you add a little bit of mouthwash to that, you can use mouthwash every day. Yeah, because then it's not concentrated. You know, it's diluted with water. And the majority of the bottle is water, not mouthwash. So, yeah.
Nice.
Win-win.
I
Yeah,
think we
it's a
should
win-win
invest in
situation.
one.
Yeah.
By the way, it's not that expensive. Like if you just
you know,
search
like
for
as in we should just get one.
Yeah.
I mean, even like for people,
Yeah.
if they think that I'm getting electric brush and then I'm getting mouthwash.
Water pick.
Water
flosser.
flosser. Yeah. They will think that I need to spend thousands. No, it's just maybe 200, maximum 300, like this.
Yeah, water floss is relatively cheaper, and you just stick to manual toothbrush. Then go on to your next topic.
No, I was gonna ask him something.
Yes.
For people who have veneers,
Mm-hmm.
now there is misconception about how they should take care of their oral hygiene.
So people with veneers, they should do exactly like us, right? Their oral hygiene is exactly similar to, routine is exactly similar to us. So they use soft brushes. They brush it twice a day. They use water flosser to clean between their veneers and teeth. And also they use mouthwash. So there's nothing different between them and a normal person with natural teeth. It's exactly similar to what we're doing.
And they should also go for regular scaling.
Course. So regular scaling, it depends. See, regular scaling, we always say that every 6 months. But there are some patients who are susceptible more to calculus formation. So those patients, I give them 3 to 4 months regular checkup and cleaning. But the normal patient, no, every 6 months. So it depends from person to person. This question has to be answered by the dentist himself, because he will then know what is the duration for this patient to have calculus formation, you know?
Yeah, got you. Nice. Thank you.
Yep.
Even now, you know, I feel guilty.
You need to, because like taking care of the oral hygiene means that you're lowering the risk of having caries. So nowadays, since everyone is busy and not going to the dentist, if they're not going for veneers or anything, like working in a clinic, you see like minimum cases of composite or cleaning. They are just going there for veneers, or if they have severe pain, which they waited, for months till they get the severe pain. It's usually either the treatment will be RCT, which is root canal treatment, or it will be extraction. So here comes the problem. Now, if you tell the patient that we need to do extraction, he will be like, no, why, how? I need to save the tooth. Come on, you just left it for 1-2 years without any treatment, and now you need to save the tooth? Khalas, okay, we will try to save the tooth. Sometimes we try, we do root canal treatment. If we can't, then it needs to be extracted. If it needs to be extracted, then we should think about other things that will happen after the extraction. which is bone resorption, because since the place is empty, there is no tooth or root to hold the bone, then it will go down or up, depend on where is the tooth. Anyways, then we have another problem. What is the solution, doctor? You either need to do bridge, which like there is advantages and disadvantages with that, or you need to do implant. Implant is a very long procedure. Don't think that we just put the implant today, khalas, tomorrow you're gone with a new tooth, khalas, that's it. No, you need to go to a very long procedure. And then, okay, doctor, it will be feeling like a normal tooth? No, of course no. Because you just lost a tooth, because you didn't take care, because you didn't have the proper oral hygiene.
Yeah, that's so true. I remember so many cases, like they literally, like as she said, they would wait till the tooth is like half gone, 3/4 gone, and then, no, please, I don't remove my tooth, don't extract my tooth. If it's so precious, as she said, take care of it.
Yeah.
And sometimes, okay, it's not necessarily even that just because the tooth is heavily destructed that it needs to be extracted. There's other strategical criteria as well that needs to be assessed. Like, for example, if the tooth is in a bad position, you need to consider extracting.
Of course.
If, let's say,
if the caries went into the bone level,
exactly,
then you cannot.
Sometimes the tooth looks healthy from outside, but when we take the x-ray, we see that I don't know, some people have the tendency of opening bottles with their teeth.
Yes.
What does it cause? Vertical fracture and crack. It goes literally in the middle of your tooth all the way down to the root.
Yeah.
Once you've split your tooth in half, even if the doctor promises magic and sticks it together, it will after a while break again.
Yeah.
There are doctors that promise magic.
I mean, not magic. This is a completely different topic. If it's above certain level,
no, I'm talking about the ones that are fully like they do the hemistectomy and whatever.
No,
they cut
these things honestly does not work.
Yeah.
It will work maybe for 1-2 years and then
you have to eventually extract it.
Yes.
And
when
the younger
we think
you
about
are,
treatment, you have to think about the long-term prognosis, right? It's not just 1 and 2 years ahead only. So eventually you will extract it and replace it with something.
Yes. And as we know, the younger you are, the better your chances of healing when you do implant.
Of course.
So you might as well extract when you're younger if you need to extract. And then there's the people with the third third molar, the wisdom teeth.
Yeah.
Some of them really want to keep it.
Yeah.
I don't know why.
They say that, no, it's a tooth and I don't want it to be removed. Yeah. Come on, you have...
no space.
Not no space. You have a lot of missing teeth sometimes. Khalas, only on that tooth, you need to keep it.
Yeah, they think that's actually their wisdom.
Yeah.
And plus, if there is no space, khalas, you need to remove it at least. Sometimes it doesn't come out like in a normal position. Sometimes comes out like this, sometimes comes out like this. You never know. So there you need to go to do a surgical extraction, which will be more painful. And sometimes, let's say, if the third molar will go near the inferior nerve, it will cause more problems. Sometimes it go towards the second molar roots and it will cause them to resorb. At that time, you need to remove both of your teeth. So khalas, remove just one and that's it.
Yeah.
Yeah, but to summarize it, not every case of third molar
is surgical.
Is surgical.
Yeah,
this
true.
is first. Second, not all third molars has to be removed.
But
only
majority
only
these
the symptomatic ones. Yes.
Yeah.
So the conservative approach is to check the case, check the tooth, and check the surroundings, which is the gum. If it's infected, if you have pericoronitis, so a gum that is covering
the
the tooth, then at that time, yes, you will have to consider removing the tooth. If you have an infection in that area, yes, remove the tooth. But if you have a horizontal, for example, impaction, and then it's not affecting the adjacent tooth,
no, you leave that.
You leave that. You don't touch it. There's no need for an extra surgery or unnecessary surgery, right?
And plus, for the people that they think that this tooth is like too important, actually there is some cases that they don't have this tooth.
Yeah.
Like me. I don't have any wisdom.
Missing. Yeah.
So you don't have any wisdom in you?
No, unfortunately.
I do have 2 and I removed them. The other 2 is congenital missing, yeah.
No way.
Yeah.
I had 4 and I removed all 4 in one session, surgical.
Oh my God.
And I ended up looking like, Tweety Bird.
For 1 week.
For 1 week like this. Alhamdulillah, I was 14, no one remembers.
Yeah.
I had just gotten my braces and the doctor, with the x-ray, it wasn't erupting.
Yeah.
It wasn't time for it yet. But through the x-ray, as the whole part of treatment planning, they noticed that if they do erupt, I don't have the space for it.
So they're going to push other
they
teeth.
Pushed for it. The doctor is like, you might as well do it now, then rather than wait after you do braces and then have to possibly remove it, and then it disrupts your, bite and everything, and then again you have to go through braces.
But then, coming to that, it's an interesting one because in orthodontics, when we studied, and even through literature review, they found out that third molars are by no means causing the crowding of your teeth, and they don't have the power
that's
or physical power of creating the crowding. Yes, it can probably shift the second molar, which is the tooth next to it, or it can cause some sort of a dysfunction in your bite in the very back, but there's no way that a third molar can cause crowding for all your teeth.
Because they don't have the power to mesialize all the teeth.
Exactly.
Especially molars.
Exactly. I mean, there's the equations and they studied the amount of force that tooth can exert onto everything and the amount of force required per tooth to move. And when they come to calculate all of that, the third molar can literally only move maybe the second molar and maximum the first molar. So old school thinking was just like pop the tooth out, whether it's asymptomatic or not, pop it out because it's gonna cause crowding for everything else.
Yeah, that's fine. That's the thing. I feel like dentistry is extremely fast evolving. The way the ortho treatments were done and the way ortho treatment was looked at when we were like teenagers and when we were growing up versus today is years apart.
Yeah.
Like, yes, it's it's literally years apart, but it's more like decades apart if you think of it. Like, I'm sure it was the same for you guys. When I was younger, when I was a kid, like mixed dentition. So I had primary and permanent teeth. And I was already having some, my canines were erupting from up here. And I was showing signs of crowding. So the doctors were all advising my mom, no, it's too early to start ortho treatment. This was in Iran, not here. Wait till all her permanent teeth are out and the primary teeth have fallen, then start ortho treatment, which is around 14 years, 13 years or so. And of course, they advise for extract this, extract that, definitely extract third molars, as I said. Then nowadays, it's different. Nowadays, they're advising you that, okay, even if your child is still in primary dentition or the initial stages of mixed dentition and you start to see that there's crowding, which means there's teeth on top of each other or that teeth are coming out in the wrong position, khalas, you should take your child to an orthodontist at that age, below the age of 10.
Yeah, actually, orthodontists start their consultation with pediatric patients at the age of 8.
Yeah, 8, 9.
So at the age of 8, because then their first molar started to erupt, the permanent ones.
Yep.
So then at
you
that
will be able
age,
to assess the class.
It's the first molars are out, the incisor are out.
Yeah.
So they can tell already what's the situation gonna look like. And another important thing is that nowadays they're looking at more of a non-invasive approach. They're looking at kids at a younger age and looking at their space of their mouth, the shape of their mouth. Like a lot of kids, because of thumb sucking, because of other habits like using the pacifier for too long, giving them the milk bottle for too long, and even genetically, the way that inherited through their, parents, maybe the shape of their palate, which is the upper area of the mouth, maybe it's not the correct U-form shape. Maybe it's narrow. So the doctors, if they notice it at a younger age, they can just put some simple devices called expanders and open that space so the teeth come out nicer, like in a more orderly fashion. The palate will take a nice shape. That means there's a chance that your child will not grow up to have class 3, class 2. By the time they're already forming, it can be corrected. Whereas in my time, I remember I had cousins who had like class 3, like severe class 3. They told him, wait till you're like 18 and then go do orthognathic surgery. Yeah, imagine, haram, like the guy throughout his life is like this, cannot eat properly, his bite is not normal, he's having a lot of difficulty, and then he turned 18, he had to go, essentially they break your jaw, they move it around, and then they shut your teeth together for months.
Some barbaric stuff.
Yeah. Sounds very barbaric. And it is. Like, if you think about it, for like at least 1 month, you cannot eat solid food.
Of course, it's very painful and very expensive as well.
Very expensive. Yeah. I mean, it kind of worked out in his favor. He lost a lot of weight, which he needed to, but, But what's it called? Like, it was painful for him. Whereas if they had noticed this at a younger age, they could have fixed it with headgear. They could have fixed it with braces, expanders, whatever.
Yeah. I always, when I see a pediatric patient, I always refer them to orthodontist at the age of 8.
Yeah.
Because at the age of 8 is the perfect and proper age for the orthodontist to give a pre-plan of what they are expecting the teeth to be in their positions. So then they can do like analysis, and then they can give them a pre-plan of what age they should come and start their orthodontic treatment in order to just avoid the orthognathic surgeries and so on.
And like, of course, if you cannot afford orthognathic surgery, you'll go through your adult life with any not an ideal skeletal shape to your face, essentially. Like we all, like, okay, maybe majority of people don't know that it's called class 1, but everyone knows that a beautiful face is one that's straight, not one where your chin is too far back or chin is too far front or upper jaw is too far back or front. But a lot of people have these. Why? Because at the correct age, they didn't get the treatment that they should have, which would have been quarter of the price of a surgery.
True.
But I think one thing we're talking about braces. Now, I want to also point out what we also have aligners. There are aligners that's like the new craze now, where, you go into, you're like in your 20s, you don't want to do braces. And I made that mistake. I've had braces as a teen. And then recently, a couple of years ago, I got aligners. And I think it was one of the biggest mistakes I did to my teeth. And I'm saying it as a dentist. Now, everyone, probably a lot of dentists, if they're watching, they're going to destroy me about this. But if you are putting yourself in the position of the patient and don't think about the treatment, don't think about the money you can make from it. But in the sense that braces, I feel still till today, is the more superior option. Although aligners are now available for pediatric patients and adults. One of the companies I won't name has options for both pediatrics and adults. But I think braces, traditional braces, is still superior. And if I could go back, I would still go with the traditional braces. regardless of how I'm gonna look, regardless of this weird looking metal mouth sort of look. Because although I did Invisalign and whatever liners, and it was pretty, but I ruined my bite to a degree that till today, after what, 2 years later, my bite still doesn't feel normal. You know, that interdigitation of the teeth are no longer there. And when I was working in dentistry and when I was finishing the cases of patients that had aligners, they would also complain about the same thing. And it was so common that almost 99% of the people were saying this, regardless of what brand I was using, regardless of what I was doing. But the interdigitation, the bite, where it feels completely together, is never there. And then what happens is you complain about this, you tell the dentist will try 1,000 different things. It's still not going to come back to normal. And now they're forced to finish the treatment and provide you with your retainers. And then they're going to retain that same position for God knows how long. So now I'm literally stuck with never feeling my teeth touch each other. You know, it's just that.
Okay, but you didn't. This is the first time that I know about this, to be very honest.
It's the most annoying thing ever.
I didn't know you have this issue.
Yeah, because, I mean, it's kind of logical as well, because aligners are these plastic material things that you'll put on your teeth and you're wearing it literally like 24/7. So those plastics have certain thicknesses, and that thickness is going to cause that separation and detachment between your upper and lower teeth. Very natural. That happens to me when, for example, when I used to wear night guards. When I was wearing night guards in the morning, when I would wake up, my teeth were feeling a little separated. Throughout the day, they would come back together again.
Yeah.
But then with a liner, it's not allowing you to go back.
Exactly. It's not allowing you to go back. Now you're on retainers, so that position has been retained. And my teeth are just always detached, and it feels like I'm hoping to chew my food in a regular way. Now, braces, on the other hand, looks ugly, but the interdigitation never gets disrupted because there's nothing sitting between your teeth that can cause a separation. I'm not an orthodontist, but I'm just talking even out of experience of someone who's gotten the aligners as well as braces. When I got braces, after it, the interdigitation was perfect. You know, they have ways where they put the rubber bands together from upper and lower braces, and they continuously push to create that interdigitation again. And I think
it's not only that, but
of
it's
course
also the intrusion and extrusion of teeth.
Exactly.
So with normal braces,
you can do that.
You can easily do that.
Yeah.
So to correct the bite,
yep,
you do intrusion, you do extrusion for certain teeth to correct the bite.
Yep.
With aligners, especially for molars, it's very, very difficult, almost impossible to do intrusion and extrusion.
Yep.
Right?
You can only create like buccal lingual, which is sort of a left and right repositioning.
Yeah. And
front back as well, rather than an up and down positioning.
Or rotation.
No bodily movement, just rotations.
Yeah. So I think that is the problem. I think aligners, although has been marketed to be able to fix complex orthodontic issues, you really need to be careful
what you're promising,
what you're what you're getting promised, and also what you're signing up for. If you have rotated teeth, or you have a crossbite at the back and these complex issues, or you have a class 3 that's quite severe, if someone tells you they can fix that with aligners, they're joking and they're kidding themselves, and they're just, playing games. Aligners are for those, I think, who have mild to moderate-ish cases, of repositioning the teeth front and back and putting them in a orderly fashion. Although my case was also pretty
But you
pretty
had
mild.
a crossbite.
I did have a crossbite at the back, but I think overall it was a mild case. But again, everything went well. Everything looks beautiful, but it's the interdigitation that's really annoying.
I mean,
I
it's
think
the concept.
I have a solution for you.
I remember I told you about this once. And then
I completely forgot.
Yeah.
I think
Your
you just
dentist
remember.
is very forgetful.
Yeah, 'cause I'm super busy.
busy,
He's super
yeah.
busy and
He's
so
too
on.
busy.
But we can, you know what? We can do a scan, okay? And from the scan, we can determine your bite.
You know,
Where are the places
where
that
they're not touching?
You're not touching, and we can work on that.
Funny thing is, they did this. So from the place I was doing the aligners, I told them about this, that, you know, it's not touching and it feels weird. The only four teeth that are really touching are my canines.
Okay.
Everything else feels detached. And I told them this. And then they took a impression of upper and lower. They took it to the lab. They put it together. They said they did this. I don't know. They put it together. They put the articulating paper in between. And they said, all your teeth touch. I'm like, okay.
No. That's not correct. No, what I'm talking about is digital scan. Okay, so on the digital scan, the computer will determine your bite.
Yep.
So it would give me how much bite you have on this particular tooth and how much bite you have on that tooth. So we know if you have because what happens is, if your bite is shifted to your canines, right, then obviously your back teeth are open.
Yep.
This is logic, right?
Yep.
Because anyway, the anterior are not supposed to constantly touch.
Exactly. So if you shift your bite to your back teeth, automatically your front teeth will open.
Yep.
And this is the correct way to open your front teeth and to close your back teeth, right? You have the opposite now.
Yeah.
So we can work on this. We can do it.
I think
There's
you
a solution.
should just go back to the topic and discuss the treatment plan later.
We will do a separate treatment plan for you.
Yeah.
No worry.
No, why not? Let's go here. No problem. Free consultation.
Yeah.
Yeah, I
So
mean,
whoever is looking for a free consultation, we have here a doctor. We're not doctors anymore.
yeah, see, three down and one more to go.
Yeah,
I'm taking them one by one.
Yeah.
soon.
Okay, let's
go back. Yeah.
Let's go back to talking as doctors. We're technically doctors.
Technically, but I think that pretty much, like she said, go do it early. Go do orthodontic treatment early.
And braces preferably. Even for me, like the more when I see the cases that come and go, you know, or like people around us, majority of people who've gone through aligners, I don't see them being happy with the result as much as people with braces. Yeah, it's really annoying. I admit having braces was super annoying. I even had the rubber band situation. It was not pleasant, but the result is much better.
Of course. Yeah.
I made some mistakes myself. I did not wear my retainer as I should have been. Listen, I'm a very uncompliant patient.
Doesn't floss. The brushes maybe twice a day.
No fixed retainer.
No fixed retainer.
She didn't. The orthodontist did not offer me fixed retainer.
Okay.
Okay, provided probably Holly's appliance, which probably you didn't wear.
I wore it for 2 months.
2 months.
2 months.
That's it.
Instead of 6.
Yeah.
Let's move on. But no. Generally speaking, I think braces are much better.
Yeah.
Listen, I've tried the aligners. To be honest, I just tried them for 2 months. It was so annoying that whenever you just remove them to eat, you have that weird feeling of the teeth being free.
Super free, and they still yet feel tight.
Yes, exactly.
And it's disgusting.
Because the aligner gives you a constant pressure on the teeth. That's why when you remove them, you feel like
you're free.
And by the way, I think one of the, I mean, obviously an orthodontist would know better, but I feel like one of the reasons that the results are not as great is the fact that you remove them to eat.
Yeah, but anyways, you're wearing them 24/7.
Yes, but you're wearing
Still,
them
even
24
when you are
hours, yeah.
sleeping.
To be very honest, I wasn't. Why? Because like, although the orthodontist told me wear 24/7, but let's be real, like I remove it to eat and then there's still food on my teeth. I'm not going to go brush in the middle of the mall, for example. So I'm still keeping the aligners in its case until I feel like my teeth are clean enough through my saliva. And then I open the case, I look at the aligner, and it looks disgusting. I'm like, it's okay. You know what? I'll go back home, I'll wash my teeth, I'll wash the aligner, then I put it back on. How many hours has that gone by?
You forget then.
So out of 24 hours, I think I've missed out maybe 8 hours of it.
Yeah.
Because
And then there's phone calls.
Yeah, but
How are you gonna take phone calls?
Oh
And
my
you
God.
can't speak properly.
So that's the problem with aligners,
Yeah.
right? All the researchers have said that you have a maximum of 2 hours per day to remove your aligners. Only 2 hours.
It's not realistic.
Anything more than that,
you're not getting full
you're not
movement.
getting full movement of teeth. And so when you switch to your second aligner, which is a size smaller, right? Yes, maybe it can fit, but the first one did not complete the job of the movement, right? So then comes the second one. It will do a different movement for a different tooth, not the same tooth, and so on. So you're not getting the benefit of the whole treatment if you don't wear it 24/7.
And what happens is that a lot of people who are going for aligners are doing this treatment because they don't want to visit the dentist regularly, because the dentist usually gives you at least 3-4 months worth of the trays with you.
I don't do that.
Yeah, to be honest, they used to give me like maybe 4.
Exactly.
And I would change it every week, and that's it.
I do 4 to 5 maximum, and then I keep the rest with me. Or I don't print a lot. I print 4 and 5 only. Then I see the patient again. I see the progress. I see how he's doing, how the teeth are coping with the treatment.
I know a lot that don't do this. A lot of doctors, they just give them
because
like 10,
they just
12.
want to print and get rid of the patient. No, I don't do this.
It's more economical for the dentist.
Of course. But then it doesn't take time. You need like 10 minutes to check the teeth and then 10 minutes to take a new scan to print him another 4 to 5 aligners. But that's the perfect way to get the maximum results from the aligners. Otherwise, no.
Speaking of printing, although you might think that going towards the more well-known aligner brands, which again I won't name, is going to be the best option, but I found that even though I did that, it was the biggest mistake. I don't know if they've rectified this, but when I was doing the treatment with one of the well-known brands, their printing place was not in UAE, nor was it anywhere near the vicinity. It was abroad, back in Colombia, and Colombia is on the other side of the world. So every time I needed a correction or a revision or some adjustment,
to wait for 2-3 weeks,
2-3 months.
Yeah.
Imagine I was waiting on the same set of aligners for 3 months. So what was happening is my teeth were eating away at the aligners. So eventually, after 3 months of going back, first of all, I was tired of it. I just wanted to finish the treatment. Second of all, the aligners didn't even exist. I was like chewing through them. So again, you need to be careful of, you need to be careful of what brand you go with. Just
and
it doesn't.
they're almost the same.
Almost the same.
Yeah.
Except the price tag.
Yeah, except the price tag. We're not talking about prices here, but I'm talking about the general idea of
Treatment.
aligners or treatment. They're all functioning the same. They all does the job as long as there's a certain company that gives you full support with orthodontist.
This is what I wanted to say.
Yes.
Not all are same, because some of them are just labs that are printing.
I'm not talking about these brands, but I'm talking about, because we have multiple of brands, aligner brands. So they have totally different pricing tags, right?
Yeah.
And it's not logic to go for the higher one just because of the name. They all have orthodontist who's responsible for providing treatment plans, and they all have printing machines in the UAE. Actually, not all of them, most of them. Right? So, they all do the same results.
Yeah.
At the end, you see before and after, they all do the same.
Yep.
Yeah. It's the thing you mentioned about the reason that basically aligners create that gap, it's similar to essentially when someone has TMJ like me, sorry, TMD technically, not we all have TMJ. TMD, which is joint pain because of too much bruxing and pressure and all that. One of the things they do as a treatment is a splint to create the space. Like, obviously, that's like a harder level.
Yeah.
Like a more advanced level of treatment is a splint, which you wear throughout the night, and it over time creates the space. So aligners,
that's intentional.
That's intentional. Unintentionally, and liners are doing the same thing.
And
that's why you are ending up with this space.
Yeah, and I hate it. I feel like I haven't ate food properly for the past 2 years, and it's like slowly going crazy.
I think you're gonna get a lot of hate, by the way.
Why?
When you say I hate aligners. Because look, aligners did solved a lot of cases.
Solved a lot of cases and aesthetically pleasing, blah, blah. But I think why fix it when it's not broken? So braces, traditional braces, were working fine.
Yeah.
By the way.
True, but it has a lot of disadvantages, to be honest.
For sure.
I personally, if you come to me, I hate normal braces.
Okay.
Because the patients that I see after normal braces, yes, it fixed the teeth, but it initiated a lot of other problems, which I see. One of them is
gingival problems.
Not only the gum, but the most important one is the necrotic teeth after braces, because too much pressure on the teeth.
So that's the responsibility of the orthodontist, because
here you go. With braces, with normal braces, you don't have control over your forces that you apply. The orthodontist has the control.
Exactly.
Right? But with the aligners, the control is distributed throughout your teeth because it's computerized. Okay? It will not give a lot of pressure on a certain tooth. Okay? So that's the difference. You cannot see necrotic teeth after the treatment of aligners, while you can see necrotic teeth after the treatment of braces. That's one of the disadvantages which I hate, because I see a lot of this. The second thing is the gum health. It's very difficult to clean your teeth with braces. I think you've already did braces and you know the struggle of cleaning them.
Yeah.
Okay. And if you're not like very,
diligent about it.
Exactly. Of cleaning your teeth properly and every day and 2-3 times a day, you will end up with periodontal problems. So
funny enough, while I had braces, I used to clean them properly and with floss and everything.
And even more.
So not every single patient is like that.
Yeah.
Of course, and even aligners. I mean, like I said, even a liner has the disadvantages of the lack of proper bite.
Yeah.
Then obviously the lack of compliance. So people aren't wearing it 24/7. So they're throwing their money down the drain, and they're throwing your time down the drain as the dentist. So I don't think there is a win-win over here for sure. Because even for example, with braces, you can have necrotic teeth. You can have root resorption because of the amount of movement.
Yeah.
All of these play a factor. But I think it comes down to making sure that you go to the right professional. You're not going to lab technicians doing your teeth and aligners, and just weigh your pros and cons. Do you want to be able to bite, or do you want to clean more?
Yeah, true.
Yeah.
Put very simply.
By the way, I needed to add something. Not all traditional braces are the metallic ones.
Of course.
Yeah,
there is
ceramic.
the new ceramic that it's not that showing on the teeth.
Yeah.
Some of them are whitish, beigeish show. So it will be easier for us to wear it
and not have that look.
Yeah, look of metal inside the teeth.
There's
I think
even
it would be-
lingual.
There are lingual and palatal braces as well,
Yeah.
where instead of placing them on the facial side of the
front.
teeth or the front side of the teeth, you place them at the back.
Yeah.
But to be honest, I asked one time, I asked orthodontist, he told me that the lingual is harder for them.
Yes.
Yeah, of course.
And
Because you're gonna play with your tongue.
I know. No, for them.
For the orthodontist,
Oh,
it's
yeah.
harder
to
for
place
them.
it.
Yeah, harder to place
Plus, the labial one is more effective on the teeth than
Yeah.
the lingual one.
it.
Because I was just telling him that I have a mild crowding in my lower teeth. So can I put the lingual ones? He was like, no, it's better either to keep it or to put a labial one, but not to put the lingual one.
Mm. I think it would be a nice one for an orthodontist to come down
Prove you wrong.
and talk about all these differences
Yeah, true.
and have their opinion on which side they lean on and why.
I think
Yeah.
his orthodontist is gonna be one of our guests.
Yeah.
Yeah.
Soon. Very soon.
Yeah.
Soon.
And with that, take it away.
And with that, thank you all so much for watching. Let us know what you think about the topics that we've discussed. Did you hear anything new? Or have you had any of the treatments that we mentioned here? Have you faced any of the problems that we've mentioned here? And don't forget to like, subscribe, give us a follow, and see you guys in the next one. Bye-bye.
Bye-bye.
Bye.